How do therapists teach kids to boss back OCD? Imagine feeling trapped in your own mind, with thoughts that keep spinning and actions you feel forced to do. That's what children with obsessive-compulsive disorder experience daily. But there is good news. Therapists have specific ways to help kids take control and stand up to these overwhelming thoughts and urges. One of the main tools used is called exposure and response prevention. This method helps children face the things that make them anxious, step by step. Instead of avoiding or doing rituals, they learn to stay in the moment and resist the urge to act on their compulsions. For example, if a child fears germs, they might start by touching a clean towel, then move on to touching doorknobs, and later handle objects from the trash. Each time they do this without washing their hands right away, they see that their anxiety lessens naturally. Over time, they realize they can handle the discomfort and that their fears often aren't as dangerous as they think. Therapists also teach kids emotional regulation skills. This means helping children notice when they feel anxious and stay with that feeling instead of reacting immediately. Kids learn that anxiety is temporary and that performing rituals actually makes OCD stronger. By sitting with their feelings and watching them pass, children build confidence that they can manage tough emotions. This resilience helps them feel more in control and less overwhelmed by their thoughts. Cognitive behavioral therapy is another key approach. It helps children understand how their thoughts feed their OCD. Kids learn to think about their worries like detectives, examining whether their fears are realistic or just tricks played by OCD. They discover they don't have to believe every anxious thought or act on every urge. This way, they start to see their obsessive thoughts as just thoughts, not commands they must follow. A helpful trick is to see OCD as something separate from themselves. Therapists might ask kids to imagine OCD as a funny monster or a pesky bug that's bothering them. When children talk about their struggles, they blame the disorder instead of themselves. This removes shame and helps kids understand they are not broken. It reminds them they have the power to choose whether to listen to OCD or ignore it. Parents are vital in this process. Therapists teach them to stop accommodating their child's compulsions. Instead, parents support their kids in facing fears and resisting rituals. They show calm and confidence when anxiety triggers appear, modeling how to handle stress. Between therapy sessions, parents help children practice exposures and complete homework tasks that reinforce what they learn. This teamwork makes the progress stronger. Sometimes, therapy combines other strategies. Play therapy helps younger children express feelings through art and stories. In some cases, medication can ease symptoms enough for children to fully participate in exposure work. Combining these approaches gives children the best chance to gain mastery over OCD. The goal is to teach children they are not powerless. When they face their fears and resist compulsions, they see they are stronger than their anxiety. They learn that feelings of discomfort are temporary and manageable. These lessons stay with them beyond OCD, helping them handle other challenges in life. Ultimately, children learn they are the boss of their own thoughts and actions, and that's a powerful step toward feeling free from OCD's grip.